Welcome to the deep dive, where we take the latest research and really extract the insights that matter most to you.
Yeah,
Today, we're diving deep into computer vision syndrome, or CVS. It's a growing concern for all of us in eye care, especially with screens everywhere, right?
exactly. And as eye doctors, you are absolutely on the front lines dealing with this daily with your patients.
Mm-hmm.
So we've sifted through a pretty comprehensive literature review to, well, bring you the most current findings,
Yeah,
stuff that can really inform your practice.
right. Our mission today is clear. Pull out those critical takeaways from recent CVS research. We'll look at, prevalence, risk
And
factors.
effectiveness, right?
Yeah.
Management, prevention
That's
strategies.
absolutely.
Yeah.
And we really want to focus on the methods the studies used and, importantly, what the results actually showed.
Good plan. And just for context, this review we're focusing on, it covered peer-reviewed articles from PubMed, 2014 to 2024.
Okay.
Included meta-analyses, systematic reviews,
Yeah.
really prioritized the recent highly cited stuff.
Great. So let's jump in and really screen the evidence for you today.
Nice one.
Okay, so to kick things off, what exactly is computer vision syndrome? What does it cover?
Well, CVS is kind of an umbrella term. It covers a whole range of eye and vision issues, but also, importantly, discomfort elsewhere in the body, all stemming from prolonged computer use.
So the usual suspects for eyes, eye strain, headaches.
Exactly. Eye strain, headaches, blurred vision, definitely dry eyes. The review actually had some good visuals, figures 1 and 2, summarizing those common symptoms you see all the time.
And you mentioned it's not just the eyes.
Precisely. The review really highlights these extraocular symptoms too,
Hmm.
often posture-related, neck pain, shoulder pain, back pain.
Hmm.
They're significant.
Makes sense.
And interestingly, it even touches on the potential psychological impact, links to increased stress, anxiety, maybe even depression for people really struggling with CVS.
Yeah, I can see that. Constant discomfort, pain, it's bound to take a toll. What is it about these digital screens that's so challenging for our visual system?
It's the unique visual demands, really,
Yeah.
different from print. The review points out things like less precise character definition, reduced contrast.
Glare, too, I imagine.
Yeah, definitely. Reflections, glare, even problematic viewing distances people adopt. Plus, the screen tech itself matters resolution, contrast settings, refresh rates, ambient light. It all feeds into it.
So it's more complex than just too much screen time.
While duration is a huge factor, the review consistently links over 2 hours daily with higher risk. The nature of the viewing is key.
Right.
Think about it. The average U.S. worker spends, what, 7 hours a day on computers? That puts them squarely in the high-risk zone.
Wow, 7 hours.
Yeah. And there was a UK and Ireland study mentioned. 89.5% of workers reported CVS symptoms, almost 90%.
89.5. That's staggering. Really shows how widespread it is.
It really does. It underlines the pervasiveness in the workforce.
Yeah.
And it's not just adults. The review mentions CDC data, significant screen time for kids, teens too.
And that affects more than just comfort.
Yeah, potentially cognitive function too. Sleep disturbances, maybe reduced performance in remote learning or work settings,
Yeah.
which are obviously more common now.
The review also mentions some specific physiological things happening. Can you elaborate?
Sure. So prolonged use can cause muscle spasms around the orbit, contributing to that pain. It also flags potential issues with accommodation,
Focusing ability.
right, and convergence insufficiency. The eyes not working together well up close. Plus, and this is a big one, reduced blinking.
The dry eyeing.
Exactly. Less blinking means tear film instability, which leads straight to dry eye symptoms.
And those posture pains you mentioned. Neck, shoulders.
Very common. The review cited studies, like one on bank employees in Ghana, found really high rates, like 79% neck pain, nearly 70% shoulder pain, over 82% back pain.
That's incredibly high.
It is. And another in Sudan, medical students, 78.5% with neck and shoulder pain, often directly from poor viewing angles, awkward postures held for hours.
Okay, so we have a good handle on what CVS is and its causes. Let's talk prevalence. How common is this, really, across different groups?
Well, there was a big 2023 meta-analysis in the review, pulling data from 103 studies. It gives a pretty solid picture.
And the number?
Overall estimated prevalence was 69.0%. 69%. The confidence interval was 62.2 to 75.4%. So yeah, a major health concern affecting a huge chunk of the population.
So patients aren't alone in this. It's very common.
Extremely common. Good to remind them of that.
Are there specific groups more affected? What did the demographics show?
Yes, some interesting trends. Higher prevalence in females, 71.4% versus 61.8% for males.
Any thoughts on why?
The review suggests maybe hormonal factors and
Hmm.
also cosmetic use potentially affecting tear film stability, contributing to more dry eye in women. Something to consider in your discussions.
Good point. What about location? Any geographical differences?
Yeah, quite significant. Higher rates reported in Africa, 71.2%, and Asia, 69.9% compared to Europe, 61.4%, in Latin America, 66.6%.
Why might that be, especially in Africa?
The authors proposed a few things. Poorer ergonomics seems key studies in Ghana. Ethiopia showed high percentages of non-ideal setups. Maybe lower awareness of preventative measures too, and environmental factors, like low humidity worsening dry eye.
Does income level matter? Socioeconomic status?
Interestingly, the highest prevalence, 71.3%, was in lower middle-income countries. But it's important to stress, CVS is pervasive across all income levels, so other factors are clearly at play: workplace conditions, education, access to care.
What about age groups or occupations? University students, for example.
The big variations there. Children and adolescents had a lower reported rate, around 50.5%, but university students, much higher, 76.1%.
76%, that's huge. Why so high for them?
Likely the sheer volume of screen time, right? Studying, online classes, research, social life, often combined with, let's be honest, poor ergonomic habits and not enough breaks, especially post-pandemic with more online learning.
Yeah, that shift to online, everything seems critical.
Absolutely. The review notes increased screen time for social media, gaming, particularly teens and young adults. There was an ESA statistic mentioned. This group is a big chunk of gamers, averaging nearly 12 hours a week just on gaming.
Wow.
And new tech brings new risks. The review flags augmented reality AR due to that vergence accommodation conflict, potentially adding strain.
Why might kids and younger teens have lower rates then?
The review suggests possibilities. Maybe more physical activity, potentially more parental guidance on screen limits, maybe more face-to-face social interaction compared to older groups. Plausible reasons.
One last thing on prevalence, you mentioned diagnostic criteria matter.
Oh, hugely important point.
Yeah.
Studies using the standard CVSQ questionnaire reported 61.3% prevalence, but studies using other criteria found 75.4%.
That's a big difference.
It is. It really highlights the need for standardized diagnostic tools, doesn't it? So we can compare apples to apples across research. Figure 3 in the review actually visualizes this nicely across demographics.
Okay, let's shift to risk factors. We've touched on some, but what are the key things the review emphasizes putting people at risk?
It circles back to those unique visual demands of screens. Sustain your focus, lots of eye movements, the specific accommodation convergence needed is different from print. And as we said, screen quality, resolution, contrast, glare, refresh rates can make it all worse.
And the elephant in the room, blue light.
Huh.
What's the verdict from this review?
Ah, yes, blue light. Well, the review presents the ongoing debate. There are some concerns, potential links to fatigue, some lab studies suggesting damage, but major bodies like the AOA don't currently list it as a direct cause of CVS. The review kind of implies that other factors, screen quality, ergonomics, viewing habits, are likely much bigger contributors to the symptoms people feel.
So the jury's still out, somewhat.
Pretty much. The science is ongoing, but based on this review, focusing solely on blue light might miss the bigger picture. Broader strategies seem more warranted right now.
Okay, so let's focus on those more established risks then.
Exactly. And a huge one, a modifiable one, is uncorrected or poorly corrected vision. Refractive errors, presbyopia, binocular vision issues, they force the eyes to work so much harder at the screen. Massively increases CVS risk.
So even patients with glasses need a check.
Absolutely.
Yeah.
Their everyday prescription might not be optimized for that specific intermediate computer distance. It's worth checking. And the review reinforces that AOA guideline, 2 or more continuous hours daily. That puts you in the highest risk group.
Right. It's crucial to have a clear viewpoint on these risk factors when advising patients.
Nicely done.
So moving to prevention, what does the current evidence suggest works best?
The review aligns pretty well with current AOA recommendations. Starts with a comprehensive eye exam, right? Assessing visual needs specifically at computer distance. Taking a good history, looking at environmental factors at home and work, that's key too. And it stresses collaboration, working with occupational health folks to educate employers and employees.
What about practical setup advice? What should we tell patients about their workstation?
Screen position is critical. Optimal placement. Top of the screen 15-20 degrees below eye level, center about 4 or 5 inches below, and about 20-28 inches away. Arm's length is a good, rough guide.
And documents, if they're looking back and forth.
Yeah, minimize neck strain. Ideally, position papers above the keyboard, below the monitor, or use a document holder right next to the screen. Figure 4 in the review illustrates this well.
Good tips. Lighting and glare.
Minimize glare. Position screens away from windows, overhead lights. Use blinds. Maybe lower wattage bulbs. If glare is still an issue, anti-glare screens or filters are a good option.
And for patients really struggling.
The review mentions considering single vision lenses specifically prescribed for their computer working distance. That can make a real difference for some.
Makes sense. What about posture and breaks? The basics.
Absolutely fundamental. Comfortable, supportive chair, feet flat on the floor, use armrests so wrists aren't straining on the keyboard, and breaks. The 20-20-20 rule is often cited, but the review also mentions a simple 15-minute break after every 2 hours of continuous use.
And the simplest thing.
Blink. Just consciously blinking more often. Sounds basic, but it helps tremendously with dry eye.
Okay, lots of practical advice there. The review also mentions some newer, more techie approaches.
Yes, this is where things get interesting. Wearables and AI. Smart glasses, for instance.
How would they help?
They can have near-eye tracking tech video oculography, electrooculography built in. This can monitor blink rates, maybe detect signs of strain in real time.
And then?
Give you reminders, time to blink, take a break. Personalized feedback. The review mentions Zhu et al.'s work on this.
Like a little coach for your eyes?
Kind of.
Yeah.
And other wearable sensors plus AI could monitor your posture, give ergonomic feedback, sit up straighter, adjust your chair. Denise et al.'s study explored this. There was even a study by Hamilton et al. Using AI video assessment to improve ergonomics for surgical residents. Shows the potential across different fields.
What about for kids and teens trying to reduce screen time?
The review mentions Kraft et al.'s work, looking at interventions. It's tough to get lasting change, we know that. But maybe newer tech can make those interventions more engaging for younger users.
Seems device makers have a role too.
Oh, absolutely. The review calls on them to improve screen resolution, contrast, refresh rates, build in better glare reduction. It needs to be a joint effort.
And public awareness.
Crucial. Ongoing campaigns about good visual and ergonomic habits are still needed.
Okay, prevention is key. But what if someone already has CVS? What does the review say about management and treatment based on that Singh et al. Meta-analysis you mentioned?
Right. This is where the findings might be a bit, well, sobering. That meta-analysis looked hard at 45 randomized controlled trials, nearly 4,500 people. And the bottom line, a surprising lack of strong evidence for many common treatments.
Okay, let's break it down. Optical aids first. Multifocal lenses.
Compared to single vision lenses for computer users, no significant improvement found in visual fatigue, and the evidence certainty was rated very low. No real difference in dry eye or side effects either.
Wow. Okay, what about blue light blocking glasses? They're everywhere.
Yeah, despite the marketing. The review found no significant reduction in visual fatigue compared to placebo or regular lenses. Moderate certainty evidence for that finding.
So not helping with fatigue.
Not according to this analysis. And no significant difference in critical flicker fusion frequency, CFF, or dry eye symptoms either. The authors even questioned if CFF is a good measure here anyway.
So the hype might be ahead of the evidence for blue blockers in CVS.
Based on this meta-analysis, yes. It's definitely something to assess carefully with patients asking for them.
Right. What about oral supplements? Omega-3s, berry extracts.
Mixed bag, mostly weak evidence. Berry extracts. No significant improvement in fatigue, CFF, or dry eye. Omega-3s. Maybe some improvement in dry eye, but low certainty evidence. Results were inconsistent and potential gut issues at high doses.
Carotenoids.
Very low certainty evidence for maybe improving CFF, but the clinical meaning is unclear. Combination supplements, others like green tea, probiotics, taurine. Basically, very low certainty evidence of no significant effect on fatigue compared to placebo.
So not much there either. Artificial tears, the go-to for dry eye.
Here too, surprisingly, very low certainty evidence for their efficacy in managing overall CVS symptoms. No significant reduction compared to no intervention. And reporting on secondary outcomes and side effects was patchy in the studies.
Environmental changes. Humidifiers. Ergonomic tweaks as treatment.
Humidifiers. Very low certainty, no significant difference found for fatigue or dry eye. Computerized risk assessment tools. Mixed results. Very low certainty. And ergonomic adjustments as treatment for existing symptoms. The review found no evidence.
No evidence. But ergonomics are key for prevention.
Exactly. For prevention, yes. But the studies included in this treatment meta-analysis just didn't measure or report outcomes for ergonomics used specifically to treat established CVS. That's the distinction.
Okay, crucial distinction. What about the 20-20-20 rule as a treatment?
Limited evidence. No significant improvement shown for fatigue or dry eye compared to placebo, which was sometimes just advice to drink water.
Any other interventions looked at? Yoga, more breaks.
Yeah, a couple. Yoga showed maybe some reduction in fatigue,
Yeah.
but very low certainty, concerns about study design, extra workplace breaks, also very low certainty evidence for maybe reducing fatigue, but no hard numbers reported.
So the big picture for treatment seems to be we don't have great evidence for a lot of things we commonly recommend.
That's honestly the main takeaway from the treatment section of this review. It really highlights an urgent need for more rigorous research, standardized methods, bigger samples, clear outcomes to find what really works for patients already suffering.
Right. When it comes to treatment, the evidence is still a little hazy.
Exactly. Still quite blurry.
So looking ahead, what does the review suggest for the future of CVS management? Where are we heading?
Well, things are likely to change quite a bit, driven by tech, better research, and more awareness. The review anticipates we'll finally get standardized diagnostic criteria. That alone would be huge for research and practice.
And technology's role.
Big potential. AI, wearables. They could lead to truly personalized prevention, objective monitoring of strain, much more targeted interventions than we have now.
And what about those treatments with weak evidence currently?
The fact that these rigorous reviews are showing limited evidence for things like blue light glasses or even certain lens types, it forces us to look harder for alternatives, right? We need solid evidence-based options that actually help patients feel better.
Makes sense.
The review also stresses needing to understand CVS in specific groups better. Kids with neurodevelopmental disorders, people with other visual or neurological issues, older adults. How does it manifest differently? We need tailored approaches.
And public awareness, workplace programs, those remain important.
Absolutely critical, keeping the message out there about good visual hygiene and ergonomics. Plus, we still need more research on environmental factors, including clarifying that blue light role and developing truly innovative, individualized treatments.
Okay, so to wrap up our deep dive into this comprehensive review, CVS is incredibly common, driven by lots of factors. We have many prevention strategies.
Many with good practical grounding in ergonomics and visual hygiene.
Right. But when it comes to treating established CVS, robust evidence for many common approaches is, frankly, limited.
That's the crux of it. Though emerging tech offers real promise for better prevention and maybe future treatments down the line.
Definitely food for thought. And it's vital for you, our listeners on the front lines, to weigh these findings in your clinical decisions and patient conversations.
Absolutely. And you can find a link to the full literature review we discussed right there in the description for this deep dive.
And please be sure to follow the deep dive for more explorations like this into the latest research that impacts your practice.
Yes. And if you found this discussion useful today, we'd really appreciate it if you could leave us a 5-star rating. It helps others find the show.
So one final thought to leave you with. Given this landscape of often limited evidence for current CVS treatments, what truly novel approaches might actually revolutionize how we manage this condition in the future? Where should we, as eye care professionals, be focusing our research efforts next?
Great question to ponder.
Thanks for joining us for this deep dive.